Hello, I'm Dr. Alan Bartham, and I am the owner and clinic director of Cary Chiropractic Offices and Functional Medicine. I'd like to talk to you about fibromyalgia and chronic pain syndrome and the non-drug treatment program that we have for fibromyalgia and chronic pain disease. Now, I've been a chiropractor, this is 28 years, I've been a chiropractor in practice in this office for over 30 years. And I have studied functional blood chemistry, endocrinology. I've studied under Dr. Datis Karazian, one of the best researchers in the country for treatment of chronic conditions such as this without the use of drugs, getting at to the cause of the problem versus treating the symptoms. I also am presently studying under Dr. Michael Johnson, who is the author of the book, What Do You Do When the Medication Doesn't Work? And I am continuing as a student with Apex Energetics and a company called PRL, which I'm starting with, and I'm also a student of the American Functional Neurology Institute. Now, I want to talk to you about the fundamentals here. All chronic conditions, and you will hear me talk about a number of chronic conditions, they all have some very, very common threads. Fibromyalgia, irritable bowel syndrome, Crohn's disease, diabetes, type 2, celiac disease, insulin resistance, thyroid problems, vertigo, sciatica, chronic fatigue, peripheral neuropathy, rheumatoid arthritis, migraines, autism spectrum disorders. These all have some very, very common threads in their metabolic problems, and there are neurologic problems. It can be anemias, thyroid dysfunctions, adrenal gland dysfunctions, autoimmune problems, hidden infections, food intolerances and sensitivities, low oxygen, and the big one here is chronic inflammation, and as well as neurologic imbalances where parts of the brain are not firing the way they should be. Now, what is metabolism? Your metabolism is how your body takes the food you eat daily and turns it into the energy you need to function. Okay? Now, of all the organs in your body that you have, 2% of your body weight is the brain, but uses 30% of all the energy that you put in your system every day. So of all the food you use, a third of it, roughly a third of it, is just to make the nervous system work properly. It is that metabolically active, electrically active. So your nervous system, which consists of your brain, the spinal cord, and the nerves, if you have a metabolic problem, your brain will not work right because your brain is the most metabolically active organ in your body. Your nervous system controls and coordinates all the systems of the body and relates the individual to the environment. This is Gray's Anatomy. This is the Bible for all medical, chiropractic schools, and all the other professional schools. These cases are a combination of neurologic and metabolic treatments, okay? 60% neurologic, 40% metabolic. Sometimes it's the other way around. But fibromyalgia is basically a metabolic disorder that's making your brain not function properly, which is the neurologic side of this thing, okay? You have a body and brain connection. Your brain is a sensory organ, and everything is perceived in your brain. Without your brain, it doesn't perceive anything, okay? Your body is one great big receptor. Everything here is a receptor, gets input and sends everything to the brain, and the brain has to decipher what that means. Your brain stays alive from constant input from your body's receptors and from the fuel in the form of glucose and oxygen. And you know what? We have receptors everywhere in our body. The muscles, joints, skin, eyes, ears, nose, and mouth. They are all receptors. What are the two inputs that light up your brain the most? Touch and gravity. They affect everything. Gravity affects everything in your whole body. So it's constantly exercising your body, which constantly exercises your brain. Now, the chemical and physical stresses to the brain. Anemia, not enough oxygen in the system. Blood sugar imbalances, food sensitivities, the glutens, the caseins, which is the protein in dairy, soy, immune system imbalances, these are the autoimmune disorders, rheumatoid arthritis, multiple sclerosis, fibromyalgia. Poor diet causes inflammation, thyroid dysfunctions. Certain drugs will cause problems like fibromyalgia or aggravate it. Inflammation and hidden gut infections. These are metabolic problems that create nervous system imbalances. Understand this. People that have fibromyalgia are in pain everywhere. They can't sleep well at night. They're turning into a basket case. Their doctor gives them a drug to go to sleep. Their doctor gives them drugs to kill the pain. Their doctor People that don't sleep very much, don't function during the day, and consequently these people are given more and more drugs because now they get depressed, so now the doctor gives them drugs for their depression. You know, if you didn't sleep, if you went to bed at night, woke up in 2 hours, and got back to sleep at 5 o'clock in the morning, and woke up an hour later, you would get depressed too because you're exhausted. And even those people that do sleep wake up very, very tired because their brain will not go into a deep enough sleep to get the rest they need. These are metabolic problems that are creating the nervous system to not function properly. Now, these people with all this pain in their bodies, guess what? The pain's not even in their body. What did we just say in the slide before? All input into the body is perceived in the brain. The pain is not in the body. It's the brain is perceiving pain when it's not there because the brain's not functioning properly. So what we've got here is a metabolic disorder that's causing the brain to dysfunction, and the brain says, oh, this hurts, this hurts, this hurts, this hurts, this hurts. And in fact, those parts of the body aren't hurting at all. It's the brain dysfunctioning. So once we get the metabolism straightened out, and then we get the brain to heal, it will no longer perceive pain when it's not there. Another thing that can happen is emotional stresses to the brain. Adrenal gland disorders are very common, and they cause insulin problems. They produce blood sugar problems, high triglycerides, LDLs, and all that. High insulin and glucose levels cause a breakdown of the brain and nerves, and then they start telling you that they're in pain when the body's not in pain. It's the brain dysfunctioning. Now, chronic conditions do not get better by themselves. The longer you have a chronic condition, the faster your brain dies. The Journal of Neuroscience reports that the McGill University Center for Research on Pain has found the longer an individual has fibromyalgia, the greater the gray matter loss, damage to the brain, with each year of the fibromyalgia being equivalent to 9.5 times the loss of normal aging. 9.5 times faster. In addition, it's estimated that 30 to 60% of the patients diagnosed with fibromyalgia become disabled to the degree they cannot remain gainfully employed, and that is with a myriad of medications prescribed. Well, guess what? Those medications prescribed are treating the symptoms and not the cause of the problem. And they don't do anything to get to the cause of the problem. If you don't get to the cause of the problem, the condition progresses. And guess what? The brain ages 9.5 times faster than a normal aging process. A majority of my fibromyalgic patients come to me and they can't make up their mind whether they want the care or not because their brain isn't working properly. We usually have family members come with to help them make up their mind whether they should do this or not. But understand that those medications, whether they're working or not, and usually they don't, are not doing a thing to cure your problem or reverse it. They're strictly hiding the symptoms, okay? But we all know it's not working because these people feel terrible. And you can only take so many medications a day, but you're not reversing anything. You've got a person that gets sicker and sicker. And my experience has been with these people that a good deal of these people end up with such a deteriorating central nervous system, they end up with Alzheimer's or Parkinson's. I've seen this happen time and time again. Remember, I've been in practice for 30 years. I've seen a lot. Now, how is brain-based therapy different from everything else? Well, brain-based therapy is all about functional neurology. And functional neurology is all about neuroplasticity. Neuroplasticity is the science of making the brain work properly again by teaching the brain to reorganize itself so it can find new mechanisms for firing in the brain. Okay? But you've got to get the metabolism working properly so that the brain has the nutrition it needs, the oxygen it needs, and the activation it needs. And then we give you the exercises with oxygen therapy so the brain fires properly, and then the body can heal itself and the patient won't be in pain all the time. Now, key points on neuroplasticity. Your brain changes when it's stimulated, okay? And different types of stimulation help different areas of your brain. It's as simple as that. We have to, run the proper tests and find out which parts of the brain are functioning and not functioning and get them working. So the brain requires fuel and activation. Fuel is glucose and oxygen, and the activation is the exercises that are specific to the parts of the brain that we need firing properly. Again, it doesn't work any other way, but it definitely works. Now, the therapies used for brain activation: upper body ergometers using oxygen therapy. We have all kinds of, this is just one example of the many, many things we use here, all depending on what parts of the brain are not functioning properly. Oxygen concentrators, These give 95% pure oxygen, and we have people breathing this while they're exercising. It makes the brain fire better. Therapies used for brain activation may include oxygen, vibration therapies, gentle neurologic adjustments. Now what we do with this, these are adjustments like the chiropractors give, but they're little instruments and they're very gentle. It's not the snap, crackle, pop, but what they're designed to do is not realign the spine as much as they are stimulation of the brain where it's not firing properly. Warm water calorics, balance therapies, advanced muscle retraining, auricular therapies, different sounds, make the brain work better in certain parts as well as a sense of smell, and visual therapies for brain activation are incredibly important. Your eyes are the windows to your brain, and your eyes put tons and tons of signal into the brain and get it exercising again. Colored lenses, eye exercises, all kinds of different things we do with the eyes to make the brain start firing properly again. So how do you know if it's a metabolic disorder causing your brain problem? All right, we test anemias, we test for blood sugars, the food sensitivities, immune system, adrenal gland disorders, thyroid dysfunctions, and inflammation, and those therapies for brain activation all require proper testing. This is all about the proper testing. In order to find these different problems, we have to run the proper testing. There's no other way of doing it, okay? The problem is the doctors are not running the proper tests, and even when they are running the proper tests, they are reading them wrong. It's not the doctor's fault. They depend on the labs to give them the information and tell them what's normal and what's not normal. So consequently, what happens is the doctor says, well, you know, your labs are normal. Your thyroid's working, this is working, everything is fine. However, you've got to understand that the labs take your blood tests and whatever other labs they need, and they compare the test results they get on you to all the other sick people. So what they do is they end up making a bell curve average. And as long as you're within the bell curve, they consider that normal. So they're comparing you to everybody else. That is not what was intended for labs. Labs are specific ranges that are healthy for human beings. So instead of using lab ranges, which are highly inaccurate, and the medical profession seems to just rely on these things, we use the functional lab values, or another term for functional lab values would be optimal lab values. I like that term better because people understand that this is what's making the body work best. All right, so a functional range is what you see here. The lab range is over here. The problem with that is if a lot of fibromyalgics have thyroid problems, but the thyroid stimulating hormone should only be 1.8 to 3.0, that's it. The labs are all over the place, anywhere from 0.3 to 5.7. I've seen 0.5 to 6.1. I've seen 0.45 to 5.9. I have seen these labs. Who do you believe? Well, what you believe is the science behind 1.8 to 3.0. A vast majority of fibromyalgics have thyroid problems, and they're all being handled improperly because they're told their thyroid is fine and it's not. And even when it is found to be abnormal, they've got you on Synthroid, again, a drug to make more thyroid work in your body. However, why did the thyroid quit working in the first place? And that's the underlying problem. They do not look for the cause of the problem. They're treating the symptoms, not the cause. What we are looking for is finding the cause and making the body heal so then the brain will heal. It doesn't work any other way if you're going to reverse a condition. So metabolic treatments. One of the major reasons we're getting chronic patients better is we're simply running the proper tests. And we get the better diagnosis. This is vastly different from your PPO HMO model. And ask yourself this: how long have I been going to my PPO or HMO doctor, and why am I still suffering? Because you're treating the symptoms and not the cause of the problem. It's as simple as that. We get to the root cause of the problem. It doesn't work any other way. So based on your history, we may run any of the following tests: complete blood chem panels, salivary hormone testing. These are very, very popular, and they help us understand how your adrenal glands are working in case you've got a lot of stress, and also a stool ecology profile in case you've got a gut flora problem like infection or parasite. And finally, the best of the best, and this is the best lab I think in the United States for this, food sensitivity testing for glutens and other foods. And these are blood tests done by Severix Labs. They're in Arizona. And then we can check for leaky gut syndrome, autoimmune disorders, and this will give us more information and help get to the root cause of your problem so we can get you resolved. So how many of you had these tests performed? How many people have had blood tests for food intolerances and cross-reactivity done? If you're going to medical doctors, there's a very good chance you've never even heard of these tests. They work and they help immensely. So what's next? Well, what's next is you need to call my office so we can talk and get you in for an appointment and see if there's something we can do to help you. It doesn't work any other way. The best thing we can do for you is get you in here and sit down and talk. So here's my offer. I only accept about 5 fibro patients a month. You guys require me to work really hard. First couple of visits can be very expensive, but with a very thorough examination and testing. But I'm going to tell you, if you come in for the first 2 visits, we will only charge $100, and we spend a lot of time. So if you pay in advance on that, we'll only charge you $50. All right? But the first thing we need to do is just sit down and talk and see if this is the right place for you in the first place. Okay? Now, there's 3 rules for acceptance of the case, and this is where I get sticky, because once you're my patient, I'm committed, and you better be too. Because if you're not committed, we won't accept you. You must be willing to make serious life changes. There's no other way. If I say you've got to quit eating something, you've got to quit eating it. I find so many of you eating pure garbage in the morning for breakfast, I can't believe it. Pop-Tarts. You have to take accountability for your health. You are what you eat, and if you're putting a lot of garbage in your body, you're going to pay the price, and many of you are. Now, your insurance and Medicare only pays a small portion of this. And we've made our care plans affordable so that 96% of the people that come in to see us usually only spend around $300 a month on a payment plan, okay? But if you're worried that you can't do this because the insurance isn't going to pay, and the insurance has been paying on care that isn't working for the last 5 years, how's that working for you? Sometimes we have to be responsible for our own billing, right? Insurance isn't paying for our groceries. Think about what we're talking about here. We're talking about getting to the cause of your problem and resolving your problem versus treating the symptoms. Anybody can throw a prescription pad at you and say, take these drugs and get out of my office. And a lot of women think the doctors think they're nuts, because the doctors have no idea what to do with these people, and they just keep throwing drugs at them. They drug them up so much that these people can't function in life. On a scale of 1 to 10, how serious is your illness? How has it affected your relationships and your work and your ability to enjoy life? You're not sleeping, you're walking dead half the time. Your thyroid gland isn't working, your stomachs aren't working properly, you are tired. Many of you can't even get out of bed and get functioning until you've got 6 cups of coffee in you in the morning, which is another whole problem which causes stress to your adrenal glands. So due to time constraints, I can only accept so many people. If you're going to be a patient of mine and you really are truly committed to getting well, I would love to help you. But we have to work together. It's not just these shoulders alone. It's both of us working together that's going to get you straightened out. Anyway, thank you very much. I would love to help you. Give me the opportunity. My name is Dr. Alan Barthen, and my number is 847-639-0010. Dr. Alan Barthen, 847-639-0010. Thank you.